You have probably had an X-ray. X-rays are the most common type of medical imaging used. They are fast and they are amazing at seeing the hard bits that are supposed to be in your body, such as bones, and other times the hard bits that are not supposed to be in your body, like light bulbs. But what are X-rays and how do they work? X-rays are a type of electromagnetic wave that sits somewhere between ultraviolet and gamma rays. They are classed as ionizing radiation because they knock electrons off of atoms and can cause defects in things like DNA. However, in the doses that most people have X-rays, as in once every few years, they are incredibly harmless. However, the fact that they are ionizing is why radiographers often leave the room or go behind a shield when they're using the X-ray machine itself. The most common method of generating X-rays for medical imaging is to use an X-ray tube. An X-ray tube is a sealed vacuum that has some tungsten on one side and a filament on the other. This filament is essentially what used to be in a light bulb. The filament is heated and a voltage is applied to the tungsten so that the electrons get sucked off the filament and smash into the tungsten at high energy. This causes X-rays to be released from the tungsten, and if you angle it right, the X-rays go down into the patient. X-rays get absorbed by the bone but pass through the soft tissue, leaving a shadow of the bone on a photographic plate underneath the X-ray. In the olden days, that photograph would be developed. In the newer days, that's just on a computer, and you get the shadow of your bones, such as this. X-rays were originally developed by accident when someone put their hand on some photographic film with an X-ray source above it, and then decided to develop it because why not? In fact, old-time radiographers used to calibrate the X-ray machines in hospitals by using their own hand underneath the X-ray and taking an image of it. I won't show you the pictures of that because I don't want to get banned. However, Google it and you'll see what happened to the hand after however many years of doing this. However, unless you're sticking your hand under an X-ray every single day for most of your life, you have absolutely nothing to worry about, and they are incredibly harmless and useful diagnostics tools. This is day 2 of my medical imaging series, so please make sure you're liking and following along so you don't miss any. Thank you for doing everything that you do here, and until next time, I have been Dr. Alex Foden, the Science Wrangler, and I shall see you one of these days.